Did you know that nursing interns don't get paid for their work? Quebec ERs are in the middle of a staffing crisis right now, and some say a possible solution could be paying student interns. Let's hear more from a nursing student who's taking a break from her studies this year because of these unpaid internships. Katia Maksoud is on the line, a nursing student. Hi, Katia. Thank you so much for coming on the show.
Hi, thank you.
Tell me about yourself. Tell me about your studies, how long you were studying before you decided to take a break.
So I was studying for a year and a half in nursing, and I decided to take a break when COVID started because I was told that we would have COVID positive patients, and I was just not okay with the fact that already we weren't paid for our internships, and added to that the fact that we would have COVID positive patients that we were still not going to get paid. It was just a bit too much to handle, and I think it's completely illogical that we weren't going to get paid and our own health and the health of our friends and family was going to be at risk because of our internships.
And I can imagine frustration when you see how the Quebec government last year created training programs, paid training programs, put people to work in a very short order in CHSLDs. Meanwhile, nursing interns and internships for nurses not getting that same kind of treatment. Can you tell me? You said you took a break from the studies. What have you been doing in the meantime?
I was doing a bachelor in political science in the meantime. The classes are online, and it's not something that would have put my family and friends at risk, so I decided to do that in the meantime. But I really want to, I know my career path is in nursing. I've been wanting to do that since I was a teenager, and I'm just I really want to go back into nursing. I just want to get paid, honestly.
Yeah, and with the state of the Quebec healthcare system, more stories this morning out of Laval and what's happening to even women who are expecting to give birth to a child, and how certain operating rooms are closed throughout Quebec. There's clearly a shortage. It's been exacerbated this summer as some nurses finally get a vacation after 16, 17 months of a pandemic here. So there's a huge shortage of nurses and staffing. Why do you think the government is so hesitant to do something as simple as making sure nursing internships are paid in order to fix a problem like it?
In my opinion, I think it's because it's a job that's stereotypically assigned to women. And the same goes for teachers. It was always women stereotypically that had those jobs. And if you look at any other internships that are stereotypically assigned to male, they're always paid. But it's always the ones that are in education and health that are unpaid still today in 2021. And, it used to be nurses, it used to be nuns before, and nuns were women. So it doesn't seem like a coincidence to me that it's only jobs in our field that are still unpaid. It's still illogical in 2021, but it's I can understand where it's stemming from.
Mm-hmm.
I don't know why we're still not doing anything about it. I think it's completely outrageous, to be honest.
We're with Katia Maksoud. She is a nursing student. She's taking a break from her studies. Nursing internships are not paid in Quebec. I think it's just shocking, Katia, that that's the case. Do you know, is it like this everywhere? Like, are in other provinces, or are they doing the same thing, or do you know?
I can't tell you about other provinces. I really only know about Quebec.
Mm-hmm. And you would go back if you were paid. Would you go back right away?
I'm thinking of going back in September, considering that we're not at the peak of the pandemic anymore, so we might not have COVID positive patients. I wanted to make sure with my professors before, but I think that if my teachers tell me that I might have COVID positive patients, I might not go back until the situation settles, either that or if we're getting paid, because I'm not ready to put my health and the health of the people around me at risk just for an unpaid internship, especially considering we have over 1,000 hours to do of unpaid internships in order to graduate. So,
Katia, can I ask you, is your story a common one? Do you know anyone else who took a break from nursing school or quit nursing altogether during this pandemic?
Yeah, I was actually surprised to talk to a lot of my peers that I really thought nursing was for them, and they really thought nursing was for them too. It's just that because of the unpaid internships, but also like the salary once we graduate and the working conditions, they just decided to drop out because it's not worth it. It's extremely undervalued as a job, even though like on with our patients, it can be very gratifying. It's just that if we're not paid adequately to put our lives at risk and to take care of other people's lives, is it worth it? And I don't think so, and that's why a lot of my friends and peers in school dropped out.
You mentioned pay. You mentioned working conditions. You also said you're thinking about going back come the fall. Why?
It's gratifying. I think that patients that I've had in the past during my internships, even though I wasn't paid, made me feel like my job was extremely important, and they made me feel like I was supposed to be there. It's just that I need a way to pay for my rent and bills, so I'm kind of torn right now between going back and not going back because, yeah.
Yeah, and Katia, would you think about leaving Quebec and going somewhere else that's got better conditions?
I might consider it honestly. Like until you mentioned it, I didn't really consider it, but I think that it's a really good idea, especially considering that.
Yeah, and the need is everywhere, right? So it doesn't matter what province it is.
Absolutely.
The need is there in all the provinces, and I have heard that in some provinces the those things you mentioned, salary and working conditions, is better.
At the same time, I'm not sure that I would want to leave. Just like I would kind of want to stay in solidarity with all of my friends and peers and other nursing students. I can't just like leave whenever the situation is uncomfortable to me and for others. I think that there's something that needs to be changed, and I think that's sort of why I'm talking to you right now.
Katia, thank you for talking with us this morning. I really appreciate you taking the time for us.
Thank you for inviting me.